First, language deals with what words mean. For example, the word watch. It can refer to an item that's on your wrist that you reference in regards to what time it is, or it can refer to an action that you do in the living room when you're looking at the television. It also deals with how we make new words. We make new words by adding suffixes and prefixes to change the meaning of words, such as the word friend can be friend, friendly, or unfriendly. We can also change the meaning of words by combining words, such as doghouse and car seat. Finally, it deals with how we put words together to construct sentences, and this is known as syntax, in what order words are put together within a sentence. Each of these aspects of language are made up of socially shared rules. When it is suspected that a person, a child or an adult, has a language disorder, they are referred to a speech-language pathologist or a SLP. The SLP will do assessments which will determine if in fact the person does have a language disorder and their diagnosis. It will then be determined if this person can benefit from language therapy. For this film, we're going to focus on the language disorders of infants and toddlers. The type of language therapy that has been proven effective with this population is play language therapy. This is conducting therapy using toys to help facilitate language development. You want to use developmentally appropriate toys and games with each child. Some suggestions are spinning tops, a jack-in-the-box, and wind-up toys. These toys will spin, twirl, and pop, and then stop, forcing the child to ask the SLP for help, especially since most children will have deficits in their motor skills. Other toys that are good to use are battery-operated toys. They will also make some sort of action or noise and then stop, which is a good situation to get the child to talk. Play language therapy is conducted by introducing the child to one or two toys. You can suggest or tell the child to do something with one of them. For example, if you were to bring Play-Doh into the therapy session, you can have the child mold items that correspond with words or sentences they have been targeting. Another example would be a Mr. Potato Head. You can let the child dress and arrange the pieces while talking about body parts and what clothing items you put on those parts. When you do therapy, you can imitate the child's sentences and add a few more words to it. Sometimes they will imitate that. Children will also produce spontaneous sentences in general, or by building on what the therapist says. But most importantly, the children just think of it as playing and not having therapy.